morning, good evening, good afternoon. I hope all are well. And thank you for welcome to my channel. Thank you for subscribing. Continue subscribing. When you subscribe, you ginger me up. You also help me reach a large forum of people. Today, I would like us to talk about fractures. More about fractures. And for today, the topic I want us to discuss is about fracture. And from the definition, fracture is the loss of continuity in the cortex of the bone or the structural continuity of the bone. When we talk about fracture, we have etiology of fracture, and etiology of fracture could be direct trauma or indirect trauma that can be classified under injury. We also have stress and fatigue fractures. We also have pathological fractures. In injuries, we have direct and indirect. Indirect injury is where there is is caused by sudden and excessive force that can be direct or indirect. And direct force is where maybe you hit someone or a bag of something that is heavier falls on your feet and gives you a fracture, meaning the fracture occurs at the site of the injury. Indirect is where the fracture really doesn't occur at the fracture site. At the area where the force is applied, but it occurs in a different area. Indirect force, there are forces that are involved that cause this indirect, and because of these forces, there are different kind of fractures that come up due to these forces. For example, we have a twisting force. A twisting force causes spiral fracture. We also have compressional forces. They cause short oblique fractures. There is bending force that causes triangular butterfly-like fractures. And then tension forces that also cause transverse avulsive fractures. Most of these forces are, most of these fractures and forces apply in the long bones, not really in the short bones. So we go to fatigue and stress fracture. Fatigue and stress fracture occurs when a bone that is healthy is subjected to a repeated heavy loading. For example, this is seen in athletics, dancers, and military individuals because of their extensive exercises. When in fatigue fractures, when exposure to stress and deformation is repeated and prolonged, reabsorption occurs faster than replacement, and this leaves the area prone to fractures. And it can also be seen in patients who are taking medications, especially medications with steroids or methotrexate. That's why in most countries they try to reduce the level of steroids that are admitted to the patient, because we've realized that this causes osteoporosis, and these are brittle bones and leading to fractures. So we have pathological fractures. Pathological fractures, these are fractures that occur to a diseased bone, i.e., like I've mentioned, osteogenic imperfecta, we have osteoporosis. So these are fractures that occur when a normal stress is applied to a bone and it just fractures. And little or normal stress causes this kind of fractures. So we have types of fractures. We have complete and incomplete fractures. Complete fractures, we have types of fractures. We have complete and incomplete fractures. Under complete fractures, we have three categories of complete fractures. We have transverse fractures. The fragments remain in place after reduction, and usually it's kind of straight. And then we have oblique or spiral fracture. They tend to shorten and redisplay. They're usually not stable even after immobilization and casting is done. We also have impacted fractures. Fragments are jammed together. You can't really see a fracture line. Yeah, you can't really see a fracture line. It's like crash fractures. We have comminuted fractures. Is when there is more than two fragments because of poor interlocking of fracture surfaces. They are also unstable fractures. Then we have incomplete fractures. Incomplete fractures are fractures that are incompletely divided and the periosteum remains in continuity. For example, gnostic fractures, it's usually a bend or a backward, and mostly it occurs in children. We also have compressional fractures, occurs in cancellous bones, is crumpled like in adults. The cancellous bone are vertebral bodies, calcaneal and tibial plateau. Mostly that's where we get some incontinuity of the fracture. Yes, a mature person, meaning someone with a fused bone, can have an hairline fracture that yeah, you can see it has come from a cortex, but it hasn't reached the next cortex. That is what I would say it's an incomplete for easy understanding. Yes, so we have reasons for splinting, because when we have fractures, of course, when the patient is stable, as we had seen in the previous videos of how to check, what to do, triaging, going through ABCDE, doing secondary survey, and doing x-rays. Of course, these things usually go along each other, such that when ABCD is being done, they're checking clinically for fractures, they're checking clinically for pneumothorax, they're checking clinically for response, they're checking for alertness, AVPU is being done, the ISSS, the trees, these are things that are still being done. Everything is done at the same time. That's why I was mentioning that trauma is a multidisciplinary. You can't really do trauma. You can't handle trauma patient alone, because you'll realize there is blood needed to be arrested, there is a line needed to be fixed, there is intubation needed to be fixed, there is administration of a painkiller, of analgesia needed to be done. So honestly, as a human being, we can't really do it on our own. So for that case, let's go to the reasons for splinting. Why do we normally splint? Of course, we know that there are some kind of fractures, by the way, they can heal. Most of the fractures, actually, they can heal without even splinting. But what are the major reasons for splinting? One, when you splint a patient, we are elevating the pain. When you splint, we are elevating the pain, and it also ensures union takes place in good position. That's one of the second reasons for splinting. Another reason would be promote early movement of the limb and return to function. Those would be the three major reasons. But of course, there is also swelling. We can also immobilize a patient to reduce swelling. We can also immobilize the patient to reduce fragment movement. There are also those ones. So after that, let's move to fracture healing. There are two ways in which fracture heals. One is through callus, the other one is through direct union. The one that involves through callus is due to the movement of the fracture site. Healing by callus involves movement of the fracture site. Thus, it's the natural form of healing in tubular bones in absence of rigid fixation. It has 5 stages. We have stage of hematoma, stage of periosteal and endosteal cellular formation. We have callus formation. We have consolidation stage. We have remodeling stage. When we go through these stages, we will start with the stage of hematoma. Stage of hematoma is when blood seeps seeps out through the blood, through the torn vessels, and forms a hematoma between and around fracture surface. And a stage of periosteal and intersteal cellular formation is when within 8 hours of fracture, there is acute inflammation reaction with the migration of inflammatory cells and initiation of proliferation and differentiation of mesenchymal stem cells from periosteal, breached medullary canal, and surrounding muscles. Thus, clotted hematoma is slowly absorbed and fine capillaries grow into the area. Technically, what I'm saying is within 8 hours of fracture, we've already formed an hematoma. There is movement of cells, that the hematoma that had been formed is being absorbed, and they are heading towards starting to create a new bone. And that's why we head up to the callus formation stage. So we realize that the differentiating stem cells provide chondrotic and osteogenic cell population start forming bone and cartilage in some cases. They begin to mop up dead bone, i.e., the thick cellular mass with its islands of immature bone and cartilage form callus on periosteal and intersteal surfaces as immature bone. So the callus that is formed is usually immature until some several months. So this thing, it's usually a stage that takes several months, but this one, for the callus formation, for the immature cell to start forming, it's about 3 to 4 months, 3 to 4 weeks. And then we have consolidation stage. Consolidation stage is the continuity of the osteoclastic and osteoblastic activity. The woven bone is transformed into lamellar bone. Osteoclasts burrow those debris at the fracture line and also behind them, and osteoblasts burrow through debris at the fracture line and close behind them. And osteoblasts fill the remaining gaps between fragments with the new bone, and it takes several months for this to occur. And then we have remodeling. Remodeling is when thick lamellae are laid down where stress is highly, or unwanted bad traces are carried away, and medullary cavity is reformed. Eventually reassumes the shape. It reassumes something like its normal or original shape of the bone before the fracture occurred. So we have healing by direct union. This one usually occurs to individuals that have been surgically intervened. So this occurs when the osteoblastic new bone reformation occurs directly between fragments, through gaps between fracture surfaces. Fracture surfaces are invaded by new capillaries, and osteogenic cells grow in from edges of new bone is laid. This occurs when osteoblastic new bone formation occurs directly between fragments, through gaps between fracture surface, through gaps between fracture surface are invaded by new capillaries as osteogenital cells growing in from edges, and new bone is laid down. When the gaps are narrow, osteogenesis produces lamellar bone, and the wider gaps are filled with woven bone that is remodeled into lamella bone. In surgically intervention, there is no callus formation, as we realize that callus formation is triggered by movement of fracture of the fracture site. In surgical intervention, there is no trigger of that, because the bone depends on the implant to divert the stress away from the fracture site. But this comes with a negative part, because it can cause osteoporosis, and sometimes healing might not occur at all. And as at this, thank you once more. Happy New Year. Wishing you all the best. Kindly continue subscribing, continue engaging. And if you have a question, you can contact me through commenting down below or inboxing me. If maybe you have a question to raise or a topic you want us to discuss. Yes, thank you once more.